So, hey, you all wonderful people out there, welcome. Winter in Copenhagen, summer in South Africa, because we have Helen with us from South Africa. I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, a group of companies dedicated to change healthcare through functional medicine, personalized medicine, genetics, as the topic is today. So I was like, what am I going to talk a little bit about today when I do the introduction? And I stumbled over the word transformation. So at Nordic and DNA Life, we're used to transformation. We're used to new tests, better tests, upgraded tests, new rules, new regulations, out of stock products. How do we quickly find an optimal alternative? New shipping companies, new customers, new expectations, new needs, and so on. So for 20 years, that's what we have tried to dance around with, and I think we have pretty good experience. So through all this, we want to emphasize how healthcare, basically healthcare for the future, a change in the way we think of healthcare. We want to spread the word about new treatments and treatments considerations. We want to make people understand this thing about health ownership, that they're responsible for their own health. It's not the government, it's not their doctor, it's not their mother or father or the husband or their wife who's responsible. It's ourselves. N equals 1. So we respond differently to different challenges. We respond differently to treatments and lifestyle changes. And we need to put that into focus as well. So what doesn't work for others may work for you. And sometimes it's worth trying things out. And other times it's, of course, worth staying away from it. It's based on the experience that we have. And then what is very, very important to Nordic and DNA Life is that we are better next year. Better as a company. We always want to improve and support you practitioners in a better way with better products or just better service. And that's what it's about today. So in all this, it's very, very important for me that you as practitioners feel safe working with us and working with your patients through us, and that you can kind of rest assured that we will do everything to really support you and encourage you also through teaching and webinars and so on. So I had this discussion with Chris, my partner in crime, partner in business, partner in life. And he had written this thing to a practitioner yesterday that no matter how odd a sample looks or how many complications a patient might have in regards to ordering or understanding or so on, there is always a person behind the sample or the problem, and they need our help because they may not feel great, they're sick and we are not. But we have to remember that there is a person and a reason why things sometimes looks odd or is difficult. So logic does not always play a role. So when we deal with your patients, when we help you as practitioners, we really are on a mission to achieve a change in healthcare and achieve a better healthcare and be better next year. So onto the topic today, which is health ownership for the future generations. That was the topic last week as well with the Stoneses, and a few questions came up and confusion came up, and Helen is gonna hopefully put everything in good structure. So today we have Helen Gautschi on, my good colleague. I'll tell you what, when we are at exhibitions and I can't answer questions, I'm just like, Helen, can you help? So this is who we have on here. Like, she is so dedicated to genetics. She's a dietitian and she holds a bachelor in science dietetics. And at DNA Life, she works as our very good educator. and our researcher, and she's tough. She's really tough. There's no gene that just passes her and that we report without her having approved it and let the gene have its exam at her table. So she has a long list of things like how many articles, peer-reviewed articles has been published around this gene. Is the gene actionable? Can we communicate it, and so on? So she's a hard nail when it comes to choosing the genes, and we have wish lists from a lot of our practitioners, but Helen has to approve that this gene is okay to report. So oh, she goes anyway. So all practitioners out there together, apart, and virtual hugs and so on. The purpose of today's webinar is to create a family and friendly community. So write questions on the side. I have my paper and pen, and I will take notes. And at the end, when Helen has finished her talk, I will put up the questions and answers, well, Helen will answer and I will put up the questions. So as usual, we are recording. And we will share the record, and Helen has already shared her slides with me, so they're ready in the email that's going to go out tomorrow or Monday for you. So anyway, let's pass the stage on to the star of today's show, Helen Gautschi.
Thank you so much, Anne-Catherine, and thank you for organizing this. It's a pleasure to be here, and I look forward to sharing our new test with everyone today. So welcome to the GrowBaby Test. It's the newest of our additions, and we can have lots of faith and word on this one. But it's our new little bundle of joy that we brought to DNA Live. And what I will be discussing with you today is really what is the test about? How do you use it? When do you use it? Why do you use it? And then I'm going to go into a little bit more of the technical detail around each of the biological areas that we are reporting on in the test. But I don't want to go into too much detail with that. So there'll be the slides available to you, but I'm not going to go into too much of the detailed science, because this is more an overview of how to use the test and when and why to use the test. So one of the main reasons behind developing this test, when we with Dr. Leslie Stone and with Emily Ridbaum, was to actually their vision behind this was to improve the maternal health as well as the future health of the unborn child. So maternal health is a key focus, to have as healthy a pregnancy, as happy a pregnancy as possible, to ensure that when you go into labor, or it's a planned C-section or whatever it might be, that it's as healthy a birth as possible with as little stress as possible. And that so when we're looking at the birth outcomes, they are optimal outcomes. And from there, because of what has happened pre-conception, in utero, and then once your child is born, you obviously want this little baby. It's a gorgeous bundle of joy that you want to be healthy right there and then, but you want this child to be healthy at 18, at 20, at 80 years old. You want this child to continue to be healthy. And this is where this very important concept of transgenerational health comes into play, where what happens in the mother's womb, what happens pre-conception, actually affects that child and that adult later on in life. Of course, there are many other environmental factors that play a role, throughout that child's life, but it is very important that we give our future generations as healthy a kickstart as possible. So that's the vision behind the test. But then if we go into the key areas of what we are actually able to report on and identify when we look at the research, and then we get the genes involved, is when you look at this image, this should hopefully be able to tell you quite a lot about what we're able to try and do with this test. So when we're looking at optimizing birth phenotypes, what we mean by that is we're looking at optimizing size for gestational age. making sure that when you have your baby, it is the right size for gestational age. It's not too big, not too small. Looking to carry to full term, so avoiding preterm birth, and improving resilience, avoiding that stress dysregulation phenotype, which was actually a term coined by Dr. Leslie Stone, where if during pregnancy you are exposed to high stresses, and you do not have the resilience type genotype, together with the right nutrients around, you may undergo more stress, which then gets passed on to your unborn child. And eventually when that baby is born, they have a higher risk of a stress dysregulation, a decreased resilience, which may affect many behavioral and diseases of lifestyle risks down the line. So that's what we're able to really report on in this area. And what we're hoping to really achieve is improving those birth phenotypes. We're also able, on the other side, in the blue, you're able to see looking at managing and improving birth outcomes. And that's where this is around maternal health, which obviously the healthier the mom, the healthier the baby to be. So looking at preventing or decreasing the risk of preeclampsia and gestational or pregnancy-induced hypertension, preventing or decreasing the risk for gestational diabetes, and then preventing or decreasing the risk for miscarriage and pregnancy loss. So all of those things that affect the mom will also have a positive effect on the baby. The healthier the better we intervene, the better the outcomes for the baby. And then lastly, in the green, one of the major kind of outcomes that we report on here is the birth conditions. And that's looking at really mental health and how we can, by increasing or focusing and targeting the right diet, lifestyle, nutrient interventions, we can really improve the mental health of the child to be. So that is really what we're able to report on with the test. And in my next slide, I actually go into it, and I've mentioned it again, so it's just a little bit of repetition. But what I want to emphasize with this test is it's a genetic test. So we're looking at gene variants or variants in genes involved in key biological pathways that have been studied specifically around the area of maternal health. And so when we're reporting on these gene variants, it's very much the research is focused on how will this affect the mother and how will this affect the child to be. So we may have variants in tests such as DNA health or DNA estrogen that we are also reporting on in this test. But remember, when we're reporting on it in GrowBaby, we are focusing on the research that's associated with that preconception and perinatal time period to understand how we can best optimize the outcomes for mom and baby. Okay, so it's very much, the research is very much focused on a very specific population group. So that's just something very important to keep in mind. And obviously we are just again emphasizing that these are low penetrance genes. So what I mean by that is no gene on its own will cause any of these phenotypes or outcomes or conditions. They are variant upon variant upon variant, together with what our diet is, what we're taking in dietary wise, what we're doing lifestyle wise, what we're exposing ourselves to in our immediate environment in terms of, are we out in the open countryside or do we have a high pollution exposure? And then also, what are we exposing ourselves to medication wise and supplementation wise? So all of these factors come into play when really trying to achieve the healthiest outcome for mom and baby. So when to do this test, I think that was one of the things I'm going to keep back here. When to do this test was one of the major, it's one of the major questions we get asked for any test: when to do what test? So this test is specific and really focused for mom to be. Okay, so we really are targeting mom in this area. and that is for mom who might be mom to be who's planning to fall pregnant, so planning to conceive. She hasn't yet conceived, and that might be the best time to start putting into place these key targeted interventions. As we heard last week with Emily and Dr. Stone, they mentioned that the faster you, or the earlier you get these interventions really entrenched in an individual, the better the long-term practices are going to be. So one of the best times, just in terms of building healthy habits, is to target the mom who is planning to conceive. On top of that, some of the interventions in terms of what we've seen in the studies is that when you're looking at methylation or actually many of the other biological areas and some of the specific birth outcomes, for example, some of the most effective time points to intervene to get the best outcomes for your baby is in that pre-conception time period. Okay, so that I would say, if you can really target the pre-conception time period, that is really your number one point. But having said that, there are interventions that can be put into place the whole way through first, second, and third trimester, even for a mom who might who's already had her baby but is feeling very overwhelmed or stressed and went through a number of health issues. It might be something to consider, because maybe for just building her up, it's very much around the research is very much focused on the female health here, and building her up possibly for her next pregnancy. It's a good place. So it's very much around when to do it is pre-conception or any of the first, second, or third trimesters, and why to do it is to have the best possible health outcomes for mom, best possible health outcomes for baby, way into that baby's life. So when that baby is now no longer a baby, we want to still make sure that we've provided the strongest platform for that child. So that is the why around the test. And then we get the questions around, with regards to fertility. Do we want to look at some of the other DNA tests that we have, some of the other wonderful functional tests that we have? And so when it comes to fertility, this test would be very useful, definitely. So you would definitely consider doing GrowBaby for fertility, but it probably wouldn't be the only test that you would look at. You would want to look at some of your other functional tests, possibly looking at hormone levels. You would want to do looking at your organic acid levels. So a number of other functional tests would come into play when we speak about fertility as a whole. We want to address it in a very holistic manner. And so this test would be very useful, but we would want to build on this test in terms of looking or considering just fertility. This test is really fantastic for considering the healthiest mom, healthiest baby. Okay, and very much focused pre-conception, first, second, or third trimester. So that's the why and the when. So hopefully that just clarifies when you would do this test, why you would do the test. And so then this is where you will recognize this slide that actually was shown to you last week and is included in the report. It's a Venn diagram that I wanted to highlight and share with you for two reasons. One, you can see some of the major genes that are coming into play when we are looking at reporting on GrowBaby. So we're looking at 44 genetic variants in 27 genes involved in 11 key biological processes. But what was highlighted last week and what I want to emphasize with this is that when we address one biological pathway with genes such as your GSTA1 and GSTM1, which are involved in phase 2 detoxification, when we address that kind of weakness in the biological area because of possible variants that you carry there, you're actually able to improve the outcomes of recurrent pregnancy loss, of preeclampsia, and then looking at your GSTP1, it has a number of other areas that you're able to address as well. So instead of really focusing on the final outcomes, if we can address the biological area with targeted interventions that are very specific to this perinatal time period and preconception, we are able to get really good results and really good outcomes for mom and baby. Okay, so that's just what I wanted to highlight over there with this Venn diagram. So moving on then, when we get into the actual body of the report and what you're able to identify and what you'll actually get in terms of the genes and the biological pathways, you'll see that it is quite a comprehensive test. There are a lot of areas that we are looking at. And you will notice there is some overlap with some of our other tests as well. And so when I go through each of these areas in a little bit more detail, I will highlight to you where the overlap is and why sometimes actually, if you're focusing specifically on this time period in a woman's life, it would be better to do this test because the research, as I said, is very much focused around preconception and the perinatal time period. So the variants don't always, you won't always see the same impact factor in another test compared to what you will see in this test, because it's a different kind of, a whole different physiological process that happens when you fall pregnant. Okay, so I just want to go through how to, just the easy, or just to explain how to read the report. When you get this report, you would see these 2 pages of your biological area. The gene name would be given in the second column, then the gene variation of the gene that we're looking at, the result. So the result is the genotype result for your patient, and then the gene impact is assigned to that specific genotype result. So you could have a no impact assigned to a genotype result, as we see with in inflammation, that first SNP in inflammation, the GG genotype gives no impact, which means that because of that specific genotype, it's leading to a normal expression of the gene, a normal functioning protein, and nothing really unaltered to really address. The higher the impacts go, so when we get into low impact, there's a slight trend towards a change in that expression, which is going to affect the biological area in a slightly negative way. When we get into the moderate or high impact factors, when that is assigned to a genotype, that means because of that high impact factor or that moderate impact factor, we are seeing a significant change in how that gene is expressed, or is that gene even there to be expressed, which is then going to majorly affect that specific biological pathway. And that is when we need to, over and above the typical pregnancy recommendations that you would provide, this is where you would then start to offer additional or elevated support above your pregnancy recommendations. So it's not even just giving normal pregnancy recommendations. It's not just saying elevated support for any individual. It's elevated support at the specific time point in an individual's life. And so that's just very important to take into account. So there's moderate and high impact factors leading to a change in how that biological area is functioning, which then may have an effect on certain outcomes, phenotypes, and conditions. And so because of that, we want to target that biological area with specific dietary, nutrient, in terms of supplementation, and lifestyle interventions. Okay, so it becomes a very targeted approach to, as we said, N equals 1. So a very targeted approach to healthcare. And then occasionally you will get a beneficial impact. And what that means is sometimes, and it's not for every genotype, but sometimes a specific genotype would actually confer some kind of protection around that biological area. And that would be really beneficial in terms of maybe if there are other variants in that pathway, you can have, it can kind of negate the risk variants in that pathway. And it might just be something nice to know that you have some areas or some enzymes that are working extra well, extra hard, and doing a really good job. So there's protection in one area, but there might be possible weaknesses in another area. Okay, so that's how you would really look at these 2 pages, and then focus on where you are seeing the most amount of moderate and high impact factors coming through. And those are the biological areas that you want to focus on for that individual. So we do then actually have a scoring system in the background. It's an algorithm based on the genotypes. We weight the genotypes based on the level of evidence, based on the hierarchy in the biological pathway. And we would then give you the summary table to actually show you where you need to focus your attention. So this is just an example report where you would then see wherever there's the little up arrow in the circle, that means you're going to provide elevated. So that's the targeted interventions that you're going to offer for that individual, for example, in lipid metabolism, for phase 2 detoxification, for the monoamine oxidase metabolism, and then for insulin sensitivity. Where you see the baseline support required, what that means is that that is your baseline support for your preconception and your perinatal time period. Obviously, that baseline support will differ from country to country. Recommendations do differ from country to country because of culture and what the risks are in each country, as well as the dietary intake for that individual, and then also trimester to trimester, those interventions will also differ, but that is baseline support. Where it's elevated, it's over and above that baseline support. So then when you get into the body of the report, we will then go through each of these areas. Each of the biological areas will be listed, but wherever there was an elevated support required because there were weaknesses in that pathway, we will then show you that with, again, that little up arrow showing that elevated support is required. So the description of the biological area is given for this specific for the area, and the elevated support kind of icon and description is also given with a little explanation of why there would be elevated support required. So there's that gene results and explanation given. And then related to each biological area, when elevated support is required, we show you the specific potential areas of risk that have been related to that biological area. So it's not to make major focus on these areas, but it will, for the practitioner and for the patient, provide some insight as to which phenotypes, conditions, outcomes one would really want to address and put in targeted interventions to avoid those and to improve the outcomes in those areas. But if you focus on building up the biological pathway, that is the best targeted approach. And then what we give, and this is actually something that was provided to you as an example last week with methylation as the example, where there is elevated support required, a table of recommendations with regards to nutrition, nutrients, and that's what we mean by supplementation, and then lifestyle advice to support that biological area will be provided. So this is where it becomes very personalized. The examples and the foods become very practical, very accessible, and there's a lot of information that is provided in these recommendations. So it really is, I find it's really very tangible for both the practitioner and the patient to get that translation from the genetics into actionable information to support that biological area. So this is over and above your baseline recommendations, and that would be given to you wherever there is elevated support required in a biological pathway. Okay, so that's really how to read the report. I'm now going to go through each of the areas in a little bit of detail, just discussing why we've included each of these areas. There are some beautifully designed images here that I'm not going to go through in a lot of detail, just for the purpose of time, and also it's more an overview of how to read the report, why, when, and what we will be providing is a very in-depth educational a program that you would be able to get involved in from next year. So we're launching that next year, and that would be a much more in-depth understanding, giving the insight into each of these biological areas, the genes in much more detail. But I'm just going to cover each of these areas just as an overview at the moment. So lipid metabolism is the first biological area that we list in this report in GrowBaby. And why are we listing it? Why is it important? Well, we know that cholesterol plays an important role as a nutrient required for normal fetal development. It's an essential component of your cell membranes and for synthesis of your steroid hormones, which is obviously absolutely necessary for normal fetal development. So you want that cholesterol to cross over in a healthy manner to the fetus. As an endocrine secretory tissue, the human placenta releases your apolipoproteins, particularly your ApoA1, and the one that we're looking at here is your ApoE. And so because ApoE, we know there's a very important SNP on ApoE, we now see that the placenta actually releases this apolipoprotein, and it is essential in the fetal development, in normal fetal development. The thing is, though, depending on the variant that you have on your apolipoprotein E gene, it is going to change the structure of this protein, and thus how these the cholesterol or lipoprotein constituents actually get transported across, and what types of cholesterol get really deposited at higher levels. And so there are two SNPs that result in 3 allelic isoforms. So we know from the DNA health test, we actually report on ApoE. So you could either come up with an E2, an E3, or an E4 variant. And because there you have, it's 2 copies of the gene. So you would have an E2E2, an E2E3, E3E3, E3E4, E4E4, or E2E4 combination. So one of the 6. So when we are speaking about all of that, so depending on the genotype result that you have, you would be assigned an impact factor. And this is actually something that's very important, and making just my point even further around, this is a very specific time period in a woman's life, that whether you have the E4 genotype or the E2 genotype, it would be related to potential risk areas. Whereas we know that in DNA health and even in DNA mind, your E2 variant actually confers protection in many ways. But when we're looking at fetal development, having too little cholesterol coming through or too much cholesterol coming through, they can both be an issue. So it's that balance that we want to get right. So considering what we're getting in from our environment in terms of the fats, in terms of specific nutrients to support good ApoE functioning, both E2 or E4 actually might confer a specific risk. And so you would get specific targeted interventions based on whether you have either the E2 or the E4 genotype. So again, just understanding that, yes, there is overlap with, say, DNA health or DNA mind with lipid metabolism, but the information that we are providing is going to be very specific to this time period. Also, what you will see is that when we give the interventions, they are very practical and again targeted to this preconception perinatal time period. So I'm not going to go through all of these interventions in a lot of detail. This is what you would see in the report. You would also be able to get a sample report from us. So I'm not going to spend a lot of time on this, but as you can see, it's very practical. We speak about focused foods. We talk about what you can increase, what you should limit, and what you should avoid. In terms of nutrients, we speak about the specific targeted supplement. We sometimes even give a dose, and that is obviously then taken further by the healthcare practitioner, and then you can work with what the patient is taking in dietary wise, what you might consider other risk areas, and then you can play around with that dosage even further. And then in terms of lifestyle, we again give really nice practical recommendations around pollution, around weight management. For this example, we talk about stress management because that becomes very important as well. So so each area is going to have this recommendation table, which is very nice and practical, and a good take-home message for you. Okay, the next biological area that we speak about is inflammation, where it's really interesting. There's been actually quite a lot of research done into this, where they measure the expression of your pro-inflammatory cytokines during the gestational period. And they've related this very strongly to having a small for gestational age baby. So this then comes across, and these specific SNPs were actually picked up in a paper specific to looking at small for gestational age, having a small for gestational age baby, where if you have a high kind of pro-inflammatory phenotype, which is then egged on by these pro-inflammatory SNPs, so it's your environment plus these pro-inflammatory SNPs, it will increase the risk for this SGA phenotype, or small for gestational age phenotype. As you know, IL-6 is actually measured in a number of our other DNA tests. You can measure IL-6 as well as CRP in the serum, which would be very useful markers to take across into your biochemical tests to measure whether your interventions are working. Keeping in mind the SNPs that we are assessing here in GrowBaby are not the same SNPs that we are testing in the other tests. Okay, these are very specific. It's research that has been done specific to this this phenotype, small for gestational age. So these are not the same SNPs that we talk about in the other tests. Okay, so it's been very specifically reported and associated, these SNPs, with small for gestational age. Okay, if that comes up as a risk, again, you would get your recommendations and very specific recommendations to target the expression of IL-6. In terms of supplement, we give that again, and then lifestyle would be baseline support. So you will see each of these recommendations. You'll be able to get the idea that it is very comprehensive in terms of what we are providing. Next, we look at detoxification, where this becomes a very important pathway. This becomes, it's automatically accepted that this should be in the test. What we're exposed to from our environment, what we eat, what we drink, will affect the fetal development. So just a little bit of background, our detoxification process aids the removal of harmful substances such as your pollution, alcohol, and drugs from the body. And exposure to toxins shortly before, so pre-conception, as well as during the perinatal time period, increases oxidative damage to the mother. And that will then in turn have an effect on the fetal development. So many of the toxins to which the mother is exposed are transferred to the fetus in one form or another through the placenta. And the level of toxin exposure on the fetus is also very strongly dependent on the effectiveness of our detoxification system. So the longer these toxins are kind of hanging around, the higher the risk on the fetus will be. And so in this detoxification area, unlike our other tests, we've actually very strongly divided these two areas into phase 1 detoxification, which is governed by our cytochrome P450 family. And when we have variants in this phase, it means that they may be working faster than we would like. So they might be activating the toxins into their reactive intermediary metabolites more quickly. leading to increased risk for oxidative damage. And so there are potential areas of risk related specifically to phase 1 detoxification. And then, as we all know, when we're targeting phase 1 detoxification or phase 2 detoxification, the nutrients do change somewhat. So because we want to make this as user-friendly for and is targeted for the practitioner to provide interventions to the patient, we have divided these areas as well. So there are nutrition, nutrients, and lifestyle recommendations given for phase 1 detoxification that will be different to what we see in phase 2 detoxification, which is then governed by many enzymes, but one of the key areas related to the maternal and fetal health outcomes are your glutathione S-transferase enzymes. So that's where we take a glutathione molecule and transfer it to that intermediary metabolite, neutralizing that metabolite so it can be more easily excreted from the body. And so we want this phase to work as effectively and efficiently as possible. And if there are variants, and we then see the moderate and high impact factors come through here, these are potential risk areas. You will note there's a little icon with just the description of each of these risk areas provided. So you just get an idea of what you might be dealing with in this pregnancy. But then again, targeted support will be provided for phase 2 detoxification. And we know things like Brazil nuts, which are high in selenium, our cruciferous vegetables, which will increase the expression of our phase 2 detoxification enzymes. We need our protein to support the glutathione production. And then we also focus on specific key nutrients that we might want to consider on top of nutrition. And then you'll see that each of the areas in terms of lifestyle now, baseline, it would just be baseline support, whereas for phase 1 detoxification, there were a lot of interventions around lifestyle that become very important to avoid the toxin exposure. So very targeted here for phase 1 and phase 2 detoxification. Then moving on to one of the, I think this is a major area that is, methylation is a major area, and it was actually discussed as the example last week in terms of healthy pregnancy outcomes. There's so much research that goes into this methylation pathway, into the epigenetic outcomes that occur in utero. So the research is fantastic in this area, and it is robust. And we see that, again, it's diet, it's environment, it's that in combination with what is happening in our own methylation pathway, which will then add together actually what's happening in your little baby's methylation pathway that will affect the pregnancy and fetal health outcomes. What we're able to measure here, though, is mom's methylation pathway, and that gives us a lot of good indications and insight of what to do. So this image just showing you some of the key nutrients that are required for supporting methylation, and then to really offer healthy outcomes. And this is an example, actually just an image that is extracted from one of these great papers, quite a recent paper discussing DNA methylation in pregnancy and how it will affect adverse or normal pregnancy outcomes depending on what you're putting into the body, how your enzymes are functioning, which will then lead to healthy epigenetic outcomes or altered regulation of gene expression of the vital genes involved in placental development. And that then leads to an increased risk for adverse pregnancy outcomes, which increases then risk. So not only on the pregnancy outcomes, but it will increase risk for your non-communicable diseases of lifestyle in the offspring and adult life. And again, coming back to that vision that we were speaking about when we develop GrowBaby, it's not just wanting of course you want to hold a healthy baby when they come out, but you want to make sure that your child, when they're 18, when they're 20, when they're 30, they're still healthy and happy and mentally healthy as well. And this pathway is so important in affecting that. So you can just see, I'm sure you're all very familiar with these methylation pathways. Again, for the purpose of time, I'm not going to go through it in a lot of detail, but you will note that when you've got adequate intake of your of all of your dietary, your methyl donors from the environment, from your diet, so dietary folate in the right form, your adequate amount of protein, your B12, your B6, your riboflavin, your B2, as supporting factors for these enzymes will help with the production and the maintenance, so the production of your S-adenosylmethionine, your universal methyl donor, and then the maintenance of your homocysteine at adequate and not too high levels, which can adversely affect pregnancy outcomes. And so if we're then able to make adequate amounts of this universal methyl donor, our very important methyl transferase enzymes, such as COMT, such as your DNA or your histone methyl transferase enzymes, will be able to transfer that methyl group to phospholipids, to neurotransmitters, and to your DNA and to your histones to ensure adequate and optimal regulation of gene expression for vital genes involved in placental development, leading to normal, healthy pregnancy and healthy outcomes. So that's the goal of methylation. And it was discussed quite a lot last week, so I'm not going to go into it any more detail than that. But then you will see that this is a very comprehensive profile where we are looking at genes that do overlap with our DNA health test, but there are other genes in here that actually look very much at choline requirements and looking at some stress dysregulation phenotypes that have been very strongly, again, linked to what is coming in from the environment in that perinatal time period, which will affect mom and baby later on. And we know that choline is so important for mental health, for physical health, but there's so much research that has actually that supports these genes being very specifically included in this test with regards to choline requirements. Of course, your methyl folate, your B12, your riboflavin, but all showing that if there are weaknesses in these areas, we are actually going to see many potential areas of risk coming through, and that's what we want to hope to avoid and achieve healthy outcomes. And so if this does come up as a risk area, you will see very detailed dietary advice, very important nutrient interventions given, as well as your lifestyle interventions as well. And then on top of that, the practitioner, you as a practitioner dealing with the patient, can go even further. From, of course, your knowledge is fantastic in this area, so we support you to then support your patient in the best way possible. Moving on to some areas that are not included in any of our other tests. This cell signaling, this gene CHRNA7, is a major component of your brain nicotinic receptors. So it's actually called, this CHRNA7 is called your acetylcholine nicotinic, or nicotinic acetylcholine receptor. And why it's called, why it's got the nicotinic part is because of nicotine. It's one of the major receptors where one of the external ligands for this that binds to this receptor is nicotine, and it changes the conformation of this receptor and leads to the release of your dopamine, your adrenaline, your noradrenaline. So very important in neurotransmitter release and kind of control in this area. But again, it's got the acetylcholine part as well. So that would be your intrinsic ligand for this receptor. So this receptor binds to acetylcholine, and it undergoes an extensive change in conformation that affects all subunits and leads to opening of ion conducting channels across the plasma membrane. So that's where I was speaking about the importance of mood regulation and neurotransmitter regulation. It's very important in that pathway. So this gene is located in a chromosomal location involved in the genetic transmission of schizophrenia as well as autism spectrum disorder. And so it's not to say that having these variants and having high risk impact or high impact genotypes here mean that you are going to have a child on that autism spectrum. It's not at all saying that. There are thousands and thousands of genes involved in autism spectrum. But what it is able to provide in terms of intervention is there's great research to show that when you support this gene, and this is one of the requirements that we look at when we include these genes in our tests, is we need to offer interventions. We need to offer targeted advice. It's not just giving you a genotype and a risk. It's offering you the kind of the insight, but also the solution. And so this is where understanding variants on this gene, you're able to really improve kind of the expression and the functioning of this receptor. And it's simply by providing sufficient choline. Okay, so the choline has almost become my new favorite nutrient after this test, where we're looking at, based on variation on this gene and possible other considerations, depending on your choline intake, you might have normal brain development, or if there are variations together with inadequate choline intake, there might be abnormal brain development. And so when we have insight into where there might be areas of risk, we supplement the choline, we give adequate choline, we provide good environmental and kind of social support, and then we get the normal brain development occurring. So really nice research coming through from that. And again, the recommendations, again, here now very much focused on the choline-rich food. So it's just targeting, it's nutrient-based interventions that can really help offset any weaknesses that might be occurring in these pathways. Moving on to, again, another one of the more behavioral areas, as I mentioned, the stress dysregulation phenotype is a potential risk area. That's where there might be more, just almost decreased resilience for the baby and child, increased risk for postpartum depression in the mom. And so by understanding, again, areas of risk in this pathway, we will be able to support the mom as much as possible, and also by supporting her and also understanding that this is the particular insight that we'd be getting. It's just to be preemptive with interventions. So your monoamine oxidase is an enzyme that plays a central role in the degradation process for various monoamines, which are released by your neurons and your glia cells. And your monoamines include, so monoamine oxidase is very important in breaking down your dopamine, your serotonin, and your norepinephrine, all important in stress dysregulation, or stress regulation rather. And so here, just a pathway where we're able to see where monoamine oxidase is working, again, where COMT is very important, and COMT has been mentioned in the methylation pathway. So very important in stress dysregulation, as you may all well know from other functional tests. So this is just a visual to show you where monoamine oxidase breaks down norepinephrine, as well as epinephrine, your adrenaline and noradrenaline, your dopamine, as well as serotonin. So if your monoamine oxidase enzyme is possibly working too quickly, you may be breaking down serotonin too quickly, too rapidly, and that may lead to an increased risk for depression, for stress dysregulation. So if you see variants coming through in this pathway, then we do address the pathway by really providing, so it's your riboflavin-rich foods, your vitamin B2-rich foods, which will support monoamine oxidase metabolism, and then also looking just baseline support. And again, this is a recommendation that you would provide to any pregnant woman or woman trying to conceive, but when you see a risk area and it's your genetic risks coming through, the motivation to change behavior will be so much stronger. So we know that some women will smoke their whole way through pregnancy, but when we see that this is a risk area and we're able to provide this on paper, this is your genetic risk, and you can do so much about the outcomes of your fetus by just avoiding all nicotine. It's just that extra emphasis and motivation to change that behavior. So that's one of the other really important reasons around each of our genetic tests is that motivation to change behavior, but specifically in this time period, it becomes so much more important. Moving on then, I've got just, I think, 3 more to go with you, is your neurotrophic pathway. This is your BDNF, which is also mentioned in our DNA Mind test. So BDNF is one of our neurotrophins, which are a family of trophic factors involved in the differentiation and survival of neural cells. So of course, we want this around. We want survival of our neurons, very important. And so when we're looking at BDNF, it's integral in the regulation of the stress response. It's very important in memory formation and in stress dysregulation or stress response and resilience. So multiple factors, including age, weight, exercise, urbanicity, genetic polymorphisms, which we're looking at here, your pregnancy status, and gestational age, all affect your BDNF levels. And one of the interesting things I said there, obviously preconception is a fantastic time to do this test, but another very important targeted time period when we're looking at BDNF levels is that your BDNF levels are lowest in the 3rd trimester. So that might be the time where you really want, if you're thinking about you wanting levels of BDNF, you do want to keep some level of activity going as much as possible. And the reason for that being, excuse me, now I don't, so I haven't got the intervention slide here, but the major intervention for BDNF is increasing your activity levels. So I'll get to that now, but just actually showing, again, when we're looking at the stress dysregulation phenotype, how important BDNF is. So I've got this pathway that follows on from your monoamine oxidase metabolism as well. This was taken from a paper where they were, in fact, measuring the activity of monoamine oxidase together with the expression of BDNF because of variance in both of these genes. And what they found is when you have variance in these genes, together with high environmental stress from chronic stress, together with possible maltreatment, poor diet, poor tryptophan intake, there is an increased risk for your HPA dysfunction. So then we know if HPA if your HPA axis is not functioning optimally, your resilience to stress is much lower. And so that then leads to increased risk for impaired neurogenesis, prenatal poor prenatal development, and also affecting your adult hippocampus. And so that's coming from the BDNF side. And then I already mentioned the monoamine oxidase metabolism being so important with regards to serotonin breakdown. And if that's working too quickly, that may be an issue leading to increased depressive disorder and that decreased stress resilient phenotype. And so as I was talking about your BDNF levels being lowest in your 3rd trimester, you definitely want to target those BDNF levels then, but obviously the whole way through pregnancy as well to improve resilience. And so in terms of lifestyle, the best way to increase BDNF is with exercise. It's a fantastic way. It's a nutrigenomic interaction, in fact. When you exercise, you actually trigger the expression of BDNF. So a fantastic way to increase your BDNF expression. On top of that, very important, focus on your curcumin, your vitamin B2 rich foods, again, which will increase expression. And then a lot of really good, nice focus foods, managing glucose levels to manage the stress as well. So very important interventions there to consider. Okay, so that again, very targeted to this pregnancy health and to the fetal health outcomes. Moving then on to progesterone metabolism. This is the one area that we don't speak too much about nutrition interventions, but this not mentioned in any of our other tests, but very, very important when it comes to fetal health. So when we're looking at potential risk areas around progesterone metabolism, as you would know, progesterone, it's a hormone produced in the ovaries, brain placenta, your adrenal glands, and plays a very important role in maintaining the pregnancy. So if there are risk variants on this progens, which is the progesterone receptor, there's an increased risk for having a small for gestational age baby or having recurring pregnancy loss, because there's too low a connection between the progesterone that is attaching to this receptor. There may be a disconnect in being able to then hold onto that pregnancy. And so in this case, when there are variants that occur and if elevated support is required, it's more about maintaining good baseline nutrition and lifestyle support. But when it comes to the nutrients, it's where the progesterone therapy becomes very important. It's multiple dosages, modes of delivery, and duration of supplementation. This will, of course, be monitored, should be monitored with frequent tests, evaluation, as I said, with regular follow-up, and then also by a prescribing practitioner who is able to prescribe the progesterone. So this is where you work in your multidisciplinary team if this does come up as an area of risk. Then, very interestingly, also a new pathway looking at melatonin metabolism and how it then relates to something that's quite different to what one might expect is, so where we're looking at melatonin, we know this as the sleep hormone. And here we're looking at the melatonin receptor. So MTNR1B encodes your melatonin receptor type 2, which has a high affinity for melatonin. And what's really interesting is, what we know about this, it affects the circadian actions of melatonin. So it affects our circadian rhythm, affects our ability to sleep. But what is also very interesting about this specific receptor is that it is highly expressed in your pancreatic beta cells. And this then, from what we've read in the research, is it implies that this gene variant, when we're looking at specific variants on this gene, affects your pancreatic glucose sensing, as well as insulin secretion, and therefore your risk for hyperglycemia. So it's actually very important, for more than just controlling sleep and being this fantastic antioxidant, is it's very, very important in looking at gestational diabetes risk. And because of gestational diabetes, that is very strongly linked for having a large for gestational age baby if that is not well controlled. So an interesting link there between these variants and this melatonin receptor. And so even though you might see someone who has a risk for gestational diabetes, but if you consider what they look like, they have a good weight, they're eating well, and considering sugars and fats and everything, but still they come up as having a risk for gestational diabetes, it might be because of these variants and not because of your typical insulin type metabolism genes, and obviously diet and lifestyle as well. So the interventions here would be very targeted, chamomile, and then obviously eliminating all caffeine and stimulants, and then some nutrients and then baseline support considering there as well. Second last from finished is our insulin sensitivity pathway, and again just an image here to show that our maternal dietary intake, whether that be good intake, will affect insulin sensitivity in a healthy manner, together with what we see in our genes. But if our maternal dietary intake is not great, if it is a high caloric intake with poor nutrient intake, then that is going to have a poor effect on triglyceride metabolism, on glucose metabolism, affecting insulin metabolism, increasing the transport of these triglycerides into the placenta, which increases the neonatal adiposity. Add then your environmental factors afterwards, once your baby is born, and you increase the risk for childhood obesity later on in life. So again, coming back to that vision of healthy mom, healthy baby, transgenerational health, this is what we're trying to achieve. So in this pathway, you will again see that even though we test for insulin sensitivity genes in our DNA health test, all of the genes in this pathway are different. So there's no overlap. These have all been very strongly related to particularly gestational diabetes, hence the fact that they've been included in this test. And you will see each of them, these genes playing a role in different ways in insulin signaling, or the transport of glucose, recognizing blood glucose, and being a good sensor for glucose, binding insulin, and very important in glucose metabolism. And then the last one, providing zinc for insulin maturation and the storage and processes in insulin secreting in the pancreatic beta cells. So if you have high impact factors coming through on this pathway, we will see an elevated support would be required. And then specific to these genes, we are providing nutrients to support these genes to make sure that they are acting in as good a way as possible, the possible supplementation required, and then in terms of lifestyle, it's your baseline support that you would want to advise on top of that. And our last pathway in this GrowBaby test is looking at vitamin D requirements, and fantastic research looking at vitamin D and role that it plays in immunity in the child, looking at risk for small for gestational age or having a preterm birth. But just an interesting study that I read, that not looking at these potential risk areas, but in fact, if mom's levels of vitamin D are suboptimal, that can affect the child's risk for asthma and allergies up to the age of 5. So it possibly might go on even further from that. But the risk for having immunity issues in your child way beyond the first kind of 12 months, even 2 years, where vitamin D is so important in good child health and immunity. So here we're looking at our VDR, which is encoding our vitamin D receptor. And we are looking at one gene that overlaps with our other tests, but the other genes, the SNPs do not, one SNP that overlaps with our other tests, the other SNPs do not overlap. And so these very important, again, specifically studied in this time period. And when the moderate or high impact factors that come up, you will get an increased support required. And it is so important to then ensure that your focus foods are there. Your nutrients in terms of supplementation become very important, because often it is very difficult to get in adequate levels of vitamin D, especially for all those in the dark at the moment already in winter. And then looking at your UV exposure, and there's some really nice practical guidelines given there. So as you will see, lots of practical recommendations given for each pathway. We don't go into gene or genotype specific content in this report, but that will be provided to you in the detailed education seminar that we will be bringing to you and launching next year. And then what we also provide to you in the report is at the front of the report. So we go into each of these areas in a lot of detail in the body of the report with regards to recommendations. But as a one-pager, just to identify where are your top priority areas in terms of elevated support required, and what would be the key interventions in terms of nutrition, nutrients, and lifestyle to take into account, we do give this in a summarized version. So in terms of, just as an example, I'll take your lipid metabolism. We speak about focus foods, and we will then mention omega-3, selenium, and your phosphatidylserine and your taurine-rich foods. In the body of the report, we give examples of those foods. But in this summarized page, we just speak about which focus, the nutrient-rich foods that we would want you to focus on. And we talk more about the nutrients and the examples of the foods, just so that it is summarized and easy as a take-home, both for the patient as well as for the practitioner to translate to the patient. And it's nice just to have a one-pager, we find, so that it's not overwhelming, but you can go into the detail if you so wish in the body of the report. And so that concludes the how, the what, the why. As you can see, it's a comprehensive test, very specific to preconception perinatal time period, to try get the healthiest mom for the healthiest baby and for years to come. So thank you so much. I know I've gone slightly over time here, but I am obviously available for questions.
I don't think time going over time really matters here. I think On the chat on the side, we've had there's been some really heartwarming messages here. But also a few questions, but I think people have been very, very quiet. And I think it's because, Helen, as usual, you are very, very good at presenting the data and very specific, and we have to make sure we get it all with us for sure. So anyway, you can understand why I'm really proud of having Helen as my colleague. So she's a gem for our companies. So anyway, some of the questions, one came up in regards to synergistic effects of the different genes. So one in one was Mayo A and COMT, that if there's both, you can say SNPs in both areas. Do you have any comments in regards to
so
that?
That's a really good point. And so definitely, if you start to understand the genes in more detail, and you can see then if COMT is functioning at a decreased, even so COMT, MAOA, and possibly then even BDNF as this compounding factor. So we've tried to keep the genes within their biological areas and not report too much, not relate them all into the phenotypic group, but rather per biological area. But definitely, as you understand, all of those genes will play a very important role in stress dysregulation, and they all kind of actually fit into that pathway one way or another. That if you have issues in COMT together with an altered activity in your monoamine oxidase metabolism, that will definitely have a compounding effect on possibly how dopamine is being broken down, or serotonin is being broken down. On the flip side, you may have high activity on MAOA, but normal activity on COMT, and that actually might again kind of balance out some of the it would negate some of the risk that you might expect to see if you were only looking at MAOA in isolation. So definitely there will be synergistic and compounding effects that you could pull through from a lot of these pathways. And that is something we could get into discussion, and we could discuss in that, and that's a very good point to discuss in that more in-depth educational seminar, to actually say, even though we've presented the report as such, highlighting these, just keeping an eye on these key areas, because they do work in conjunction with one another, would be very important. So definitely.
Super. Then I'm giving you some homework, I'm sorry to say. One asked if they could have the reference for the study that supports vitamin D levels in the mother in regards to that impacting children up to the age of 5.
I've got it on hand, so it's not too difficult to do.
So if it's an open access,
it is.
Super. Then we will share it with you in the mail that goes out with the recording for today.
Cool. And I've got a really nice, just general vitamin D article, which I'll share with you, and you can decide what you.
Yeah. I think you can just bring it on, or everyone who's here now. They just love this.
Great. So they're both open access, so that's easy to do.
Great. So I think we will finish for today, and just rest assured, more education will come in 2021.
Yes,
next
around the
year,
corner,
soon, maybe. So and thank you everyone for joining us and asking questions and being a part of this, because if it wasn't for you, we wouldn't be doing this. So, and of course I love it as usual, and I always fall in love with the presenters here, because it's always so exciting what you're going on about, and so into details and so on. So everyone, big virtual hug from me. Helen, thank you very much for your professional and excellent presentation. Take care all.
Thank you.
Bye. And remember, recordings will come. Take care.